di ba alam naman natin yung acne? It's an inflammatory condition that occurs in the oil glands. And depending on the degree of inflammation or the severity of acne, doon nagkakaroon ng risk of developing scars. It's not true na kapag hindi mo hinawakan yung acne mo, hindi siya magsascar. Conversely, hindi rin totoo na kapag hinawakan mo yung pimple mo, ay siguradong magsascar na siya. Hi everyone! Welcome back to my YouTube channel. Today's episode of DERM Talk is super interesting. Alam nyo, maraming nagtatanong nito sa akin palagi, and every time I post a shorts about it or a video about it, maraming interaction. So naisipan ko na gumawa ulit ng video dedicated to our topic for today, acne scars. So, isabihin ko lang sa inyo guys, meron na akong ginawang video about it on my YouTube channel, pero sobrang tagal na. I think that was way back in 2020. If you wanna check it out, feel free to scroll up and you'll find it. But let's go over it again. Kasi marami na rin ulit mga bagong treatment modalities na available, so I wanna discuss that also. Pero simulan muna natin sa unang-unang tanong na pinaka-importante. Why do acne scars form? So, yung acne scars, di ba alam naman natin yung acne? It's an inflammatory condition that occurs in the oil glands. And depending on the degree of inflammation or the severity of acne, doon nagkakaroon ng risk of developing scars. So lagi namin sinasabi na yung acne scars, usually parang commensurate siya doon sa degree of inflammation na nangyari sa skin mo. It's not true na kapag hindi mo hinawakan yung acne mo, hindi siya magsascar. Conversely, hindi rin totoo na kapag hinawakan mo yung pimple mo, ay siguradong magsascar na siya. So this is how it works. If we have an inflammatory condition on the skin, nasugat yung skin, na-trauma yung skin, syempre after nun, may healing process. But sometimes, hindi enough yung healing natin, hindi enough yung collagen na napaproduce, so pag nag-heal yung wound, may lubog. Sometimes naman, nasusobrahan ng paggawa ng collagen, kaya nakaumbok yung scar. So again, scar formation is often due to inflammation and the degree of your acne lesions. So para ma-prevent mo na yung acne mo maging scar, very important is timely and correct treatment of your acne. Having said that, let's now move on to the second question. What are the different types of acne scars? I like to categorize them into 3 different types. First are the flat scars, which could be red or brown. So yung tinatawag natin na post-acne erythema or post-inflammatory erythema, ito yung mga scars na kahit gumaling ng acne mo, ang pula-pula pa rin nila. So from afar, mukha ka pa rin may acne. Second type are the post-inflammatory hyperpigmentation scars or the brown spots. So these are common dun sa mga tao na palagi nagpapaaraw or hindi nagsa-sunscreen. So yung acne lesions nila pag nag-heal, nagiging brown. The next category would be your hypertrophic scars, yung mga nakaumbok na scars. So ito yung mga pag nag-heal sila, nasobrahan ng formation ng collagen. With the hypertrophic scars, parang pwede na rin natin dyan isama yung keloid scars, but the keloid scars are often common on the chest, shoulders, and back. Kaya minsan may mga patients na nagpupunta sa clinic na, Doc, dati acne lang to, ngayon ang laki-laki na. Mamaya pag-uusapan natin yung treatment for that. And the third and last category and the most common are the atrophic scars o yung mga nakalubog. So ito yung mga pag nag-heal sila, the skin did not produce enough collagen, kaya nakalubog siya. So under atrophic scars, there are 3 main types then. We have the ice pick scars o yung parang dots lang siya. Some patients mistake them for large pores. Second would be your box scar. So ito yung mga sharp yung edges na parang kahon. So, doesn't necessarily have to be rectangular, basta very steep. Parang alam mo where the scar starts and ends. And the last type are the rolling scars. So, ito yung pag, for example, maliwanag yung ilaw or may flash, hindi sila masyadong halata. But pag nagkaroon ng parang lighting from the top, for example, or sa elevator, makikita mo sila as sloping scars. So, those are what you call the rolling scars. Now, when it comes to treatment naman, so doon naman tayo sa pangatlong question. So, Doc, alam ko na nagka-scar ako, alam ko na rin yung types of scars ko. What treatments are available for me? Before I discuss the types of treatments, it's important to remember that when we are treating scars, hindi na talaga siya babalik dun sa dati. It will never go back to like normal virgin skin. Kasi nga, meron na siyang trauma, meron na siyang healing, meron na siyang scar formation. But with advancements in technology, we can now promise about 60 to 70% improvement. Sabi nga sa akin ng mentor ko, 50 lang daw yung promise ko eh. Pero I've seen really, really great results sa mga patients na matyaga, tapos talagang diligent sila with following up for treatment. And what you also have to remember with acne scars is, remember especially the atrophic scars, nag-heal sila with not enough collagen. And diba, as we get older, we also experience decrease in collagen. So for those with acne scars, even if say na-achieve mo na yung gusto mong appearance ng skin mo with your treatments, you still have to do maintenance treatment para hindi bumalik sa dati or mag-worsen yung acne scars mo. I hope that's clear. So now we go to the different types of treatment. When I talk to my patient about acne scars, I divide my treatment types into 2 categories. So I have the general treatment wherein I treat the entire face. Kasama na dyan yung mga areas na walang acne scars. And then I do targeted or specific treatments. Normally, I recommend my patients to combine 2 or 3 of all of them. Pero I normally start with a generalized treatment. Ano ba yung generalized treatment? Example, CO2 laser surfacing. So CO2 laser surfacing is an ablative type of treatment, meaning binablast na yung top layer of your skin mo, sinusugat na yung face mo or yung skin mo to stimulate collagen remodeling. Because when it comes to acne scar treatment, we want to do a controlled injury. Kasi that's the only time that your skin will make new collagen. So another type is RF microneedling. So ito naman yung gumagamit tayo ng mga needles na tinutusok natin sa skin natin to introduce heat and again to stimulate collagen remodeling. Kung ayaw mo naman ng heat or parang, Doc, I cannot afford downtime kasi yung CO2 laser surfacing or RF microneedling, medyo mapula ka for a few days. So for example, ang trabaho mo talaga, you're always outdoors or you have to face people and you cannot afford a downtime of 3 to 5 days, we have your mechanical microneedling wherein needles lang siya and walang heat employed and normally para ka lang mapula or rosy for about 2 days. We can even do chemical peel. So we have medium depth peels that remove like slightly below your stratum corneum. So ito medyo napapantay din niya yung mga mabababaw lang na scars. And then sometimes we may also do yung mga sub-ablative laser surfacing like your 1927 nanometer thulium laser. So when I talk about generalized treatments for acne scars, ito yung tinatarget mo yung buong face. So may scars man o wala, tatamaan siya. But normally, after we do the generalized treatment options for acne scars, may mga matitira dyan na malalalim or stubborn scars talaga. So that's when I employ my targeted treatment. So yung mga targeted treatment, it's usually for those na parang meron kang maybe 10 or 15 scars all over your face na talagang stubborn, malalim, and mahirap i-treat. One example is TCA cross. So TCA cross, we put high percentage trichloroacetic acid dun sa scar para umangat siya. This usually requires a series of treatments around 4 to 6 para makita mo yung results. Another example would be your subcision with filler injection. So I normally don't do the blunt subcision all over the face, but you can do that. But I normally do it pag rolling scars na yung patient. So, ipapasok natin yung cannula and then you just remove the fibers that are making your scars attached to the bottom of your skin. Another thing is punch excision. So, for example, meron kong scar dyan, we do a punch biopsy, we remove the skin and then tatahiin namin. So, yung lubog na scar mo, mapapalitan siya ng linear scar. If ayaw mo naman ng ganun, pwede rin tayo mag-punch elevation wherein we perform a punch biopsy and inangat namin yung skin mo para pantay siya dun sa normal skin. For hypertrophic scars naman, we can also do targeted treatment for that. So normally, ang areas of your face wherein you get hypertrophic scars are your chin and your nose. Yun yung mga parang bumps na skin-colored. Napakahirap niyan i-treat actually. You can do a combination of your CO2 laser surfacing or sometimes we do intralesional steroid injections to flatten them. Yung mga may keloid naman, ganun din, we employ intralesional steroid injections, pwede din siyang lasers. So, maraming treatments na pwede. That's why it's very, very important to consult your doctor kasi doon namin madadetermine kung ano yung bagay sa'yo. Siyempre, consider natin yung lifestyle mo, habits, and of course, your budget. That's very, very important also. And I would like to add lang pala na ngayon kasi marami na tayong mga topical treatments na ini-employ namin after a laser acne treatment. So, one example are your exosomes. I'm sure you've heard about it. So, it's quite new. Hindi siya bago in the medical field because they've been studying it for almost a decade already. But in the skincare industry or in the aesthetic industry, medyo bago lang siya. I personally use it to improve and shorten the healing time of my patients. So, kung baga dati pa nag-CO2 laser surfacing ako, usually 1 week yung downtime or 1 week kang mapula, namamaga. With exosomes, you can decrease the downtime to up to 4 to 5 days na lang instead of 1 week. And apart from that, it also improves the results. So, that's one thing that I like to add after treatment. Another thing is yung stem cell condition media. So this is a little bit similar to exosomes, but they don't really contain a lot of exosomes, rather more mga growth factors, etc. And what else? Marami na rin ngayon mga healing creams and post-treatment creams that you apply that are anti-inflammatory, that have growth factors, and that can improve and shorten yung downtime from the treatment. So it's very, very exciting in the world of anti-acne scar treatments, and I'm really looking forward to more of them. And ito pala, very, very important, hindi ko nasabi kanina. Dun sa mga may acne, I know that you're all excited, of course, to start treating your acne scars already. Pero ako kasi, I normally advise my patients to start treating their acne scars once they've controlled their acne. Why? Unang-una, sayang kasing effort mo. If you start treating your acne scars when you're still getting acne, your acne lesions can then turn into scars. So, uulitin na naman natin yung buong process. So, mas mabuti kung talagang cured na yung acne before we treat acne scars. But, you can come for consult anytime to ask about your options as early as when you start treating your acne para at least makapag-prepare ka din. And like ko sinasabi sa mga patients ko with acne scars, this is going to be a long-term relationship between the two of us. Kasi unfortunately, wala talagang overnight results. Example ko na yung husband ko. He used to have acne scars before, but after 10 years of treating it, nakakapag-crew cut na siya na haircut. O dati, tinatakpan niya yung mga scars niya here. But after years of doing treatments and a mix of a lot of treatment modalities, nakita na talaga na nag-improve yung skin niya. So there guys, I hope I was able to answer all your questions. But if hindi man, at kung meron man ako mga treatments na hindi nasagot, please don't hesitate to put them in the comments below. You can even send me questions in my other social media channels like Instagram, TikTok. Oh, and don't forget to join my Instagram broadcast channel and the Facebook community. Ang ganda-ganda ng title niya, guys. It's called The Skin Side of Things. So, I want this to be like a real community interested in skincare, skin treatments, etc. And lastly, if you enjoy this video and you want to hear more about the skincare, and treatments, please don't forget to hit the like and subscribe button and turn on notifications. See you in our next episode. Bye!